The notion of preserving your own stem cells to help treat disease sometime in the future is gaining popularity. Here to talk about this process is Dr. Bradley Briggs with Briggs Family and Cosmetic Dentistry in Scottsdale, Arizona. Dr. Briggs, welcome back.
Thank you for having me again.
Well, I guess we should start at the basics. What are stem cells?
Stem cells are undifferentiated cells that the body uses to heal and repair itself. Researchers have found that these stem cells are in a plentiful supply in teeth. They're found in all tissues of the body, but they're often very invasive to collect them. And when you're planning to have teeth taken out, it's a perfect opportunity to bank stem cells.
So, Dr. Briggs, how are stem cells currently used in the treatment of systemic disease?
There are many illnesses that stem cells can be used to treat, such as Parkinson's disease, diabetes, arthritis, and researchers are finding ways to use those stem cells to treat each of those diseases.
So we're discussing about the idea of taking dental stem cells. Can you talk about that process?
Stem cells and collecting them is a controversial topic because there are two types of stem cells. There's adult stem cells and embryonic stem cells. It has been fairly popular for years to collect embryonic stem cells from the umbilical cord when a baby is born, but there are adult stem cells that are found in teeth, and if you're planning to have teeth taken out and planned extractions, the stem cells that are collected from the pulp of baby teeth, they're in a plentiful supply, they're very healthy, and if you have teeth being planned to be taken out, if we can get those sent to a company like StemSave where they will bank those cells for you, you have a really good supply of healthy stem cells.
Okay, so why would somebody need to bank and preserve their stem cells? Why not just take them when they are needed?
Well, many people have already banked stem cells from the umbilical stem cells when their child is born. With collecting stem cells from baby teeth, those cells are derived from the neural crest. So specifically, those teeth do a better job of incorporating themselves into neural tissue injury, so spinal cord injury or things. Teeth stem cells do a good job of treating that.
And why are baby teeth such a good source for stem cells?
When collecting stem cells from teeth, the teeth that provide the best source of cells would be baby teeth or wisdom teeth or a very healthy tooth that needs to be extracted for, say, an orthodontic procedure. The blood supply to those teeth has been constant. There hasn't been any disease or decay or attack on the tooth, whereas extracting a tooth later in life, that tooth has already been through many things that a baby tooth or a wisdom tooth has not had to face.
Just to clarify, when is the best time to take these dental stem cells?
The best time to collect stem cells from teeth would be when you have a planned extraction. So if a tooth needs to go because the orthodontist is going to need that space to move teeth into, the dentist will often take out the tooth in a planned procedure. So if you can know that ahead of time and we can collect those cells and get them into the right temperature and ship them off to be stored, that's the perfect opportunity.
All right, finally, Dr. Briggs, how are these stem cells preserved?
When teeth are extracted, we collect them and put them into a cryogenic storage container that provides nutrients and keeps those cells within the tooth healthy. It's shipped to a company where they separate the stem cells out and look at only cells that are viable. They have a process which they select the cells that they know will work later in life. So you will get a report back after the teeth are shipped off as to the amount of stem cells that have been collected and the viability of those cells for future healing. The companies do a wonderful job of providing reports for exactly what they collected.
Dr. Briggs, thank you.
Thank you for having me.
My guest has been Dr. Bradley Briggs with Briggs Family and Cosmetic Dentistry in Scottsdale, Arizona. This is the Dentist News Network.